All right, our reporter Hasina Gori joins me in studio now to share a bit more on the newly launched treatment campaign. Good afternoon, Hasina. Thank you very much for joining us. So you were with the Minister today. Just take us through really the intention behind the launching of this HIV treatment campaign.
What we do know as South Africa is that we've made great strides in the last few decades with treating as well as prevention of HIV/AIDS, but the numbers are still there. Yeah. And what he really wanted to emphasize today is that we don't want to get to a stage where people feel that they can get infected and have ARVs, that we still need to ensure there's preventative, but also those that are HIV positive, that they do get the treatment that they need. We've seen growth in the numbers, but there's still a backlog. And what they're planning on is in this year alone, so till December 2025, 1.1 million HIV positive patients will be on ARV or antiretroviral therapy or treatment, and they're trying to find them, to access them. They're going to be using outreach programs. They call it Close the Gap, to go out into communities. So when we ask him how, in practice, how that will really take place, because it's 1.1 million is quite a large number. He said they're breaking it down into provinces, regions, districts, hospitals itself, to see maybe one specific hospital might only need to find 3 patients that are HIV positive that need treatment.
So how do they go about doing that, closing the gap, as you will?
They're working with many different treatment and organizations that are already working preventative as well as treatment care, working with the clinics as well. But one of the big issues that they found is that where that missing community or population is men. Women have come to the party getting tested as well as treatment and adherence. But what we find is that when it comes to men, and they're not found in clinics, they're also not found in churches and in organizations. So they're working with many different organizations. What we spoke with was CHAPS, one of the organizations that works at prevention. They have mobile clinics and they do male circumcision specifically. So they're one of the partners in this kind of initiative, where they go out into communities where men are, finding them where they're at, finding them at men's clinic, where men might find themselves scared of stigmatism, so they don't come in to test, as well as getting their medication. So this is just some of the ways that they're hoping that they will close that gap. This is also working towards broader kind of goals that the South African government has when it comes to health, as well as with HIV and AIDS.
So clearly there's quite a lot of awareness that needs to take place where men are concerned, because if you're saying their biggest target now will be those that come in for circumcision, how many are those? Because most of the adult men probably would have been circumcised, or for whatever traditional reasons might not go that route, so meaning it will still be quite difficult to access the men to come and test.
And I think that's what they were working with, many different, they even said traditional healers, traditional leaders as well, going right at grassroots level. And there's a wide array of various different organizations that work beyond just one community, in very different vulnerable groups, that is people that are living with HIV, children, adolescent girls, but also the LGBTQI plus community, the drug addiction community. So there's various different organizations within the HIV/AIDS community that are also already in place, but these are also very uncertain and unstable times, so there is concerns whether, they will continue to be able to work the way they have been.
Most certainly sounds like quite a comprehensive program to ensure that 1.1 individuals living with HIV are actually now on treatment, and one assumes this will be quite costly as well. Did the minister touch on the US aid aspect and perhaps try to allay fears, as one would expect he would?
When we did bring up the question, because as you're saying, it will cost money, we know that US aid was giving 17%. What might seem, 17% not a large number, but that played a vital role in HIV/AIDS treatment, action, as well as awareness. But what they did allay fears was that there will be money, that they will find it. But when we did speak with the other stakeholders, that includes the UN aid, they said that they're now working on various different governments, organizations that are within the United Nations AIDS kind of umbrella, and they are going out looking for willing partners that are able to come through to assist, to fund these projects. But that I specifically spoke with the UN aid department, and they really said they've come too far for us, or as a country, for us to stop with funding, that all the programs and projects that are currently underway need to continue, even if United States, does not decide to go forward with the PEPFAR, continue with USAID. But we also spoke with some other organizations that said that despite them saying they will be suspended for 90 days and there was a freeze for 90 days, that they've now got letters saying that they will be back on track. So some organizations like Right to Care as well as CHAP said they were able to continue because their organization falls under the PEPFAR, which is the President's Emergency Fund for Aid Relief. So we've seen that, but there's still a lot of uncertainty with whether after that 90 days, which organizations will get funding, also following that executive order from United States President Donald Trump that all fund to South Africa will be stopped. So there's a lot of uncertainty.
Even if there's going to be funds that are actually considered or donated, one wonders then what would be the criteria, and many would want to wrap their heads around that so that they actually ensure that they comply and they qualify to receive those funds. But as for today, were Soweto residents part of the event, and what was their reaction to the launching of this new treatment campaign?
So this specific organization you saw men that were part of the community that were there really being called to stand up to be part of this, coming in, but a lot of organizations that work at that grassroots level, they had a lot of representatives that came there from different communities. Really, I think this is something that is a huge part of one step to ensuring we get viral suppression, and that we ensure that we do not see new infections. That number of new infections still quite high, and South Africa is one of the largest populations within HIV/AIDS, numbers. So it was something that was welcomed, and it's going to be interesting to see if we make that target come December 2025, whether that 1.1 million number is achieved.
And I mean, when you talk about viral suppression, which would lead to no new infections, one wonders if that was also part of the conversation where they spoke about U equals U, and even the pre-exposure prophylaxis and how easy it is for young people in particular to access this drug to ensure that actually they are immunized from an infection of HIV.
We heard from SANEC as well, from UNAIDS specifically around this, saying that while today's program is specifically for post-infection, that there's still so much work that's being done for preventative measures, and those include, prophylactics, they include circumcision, they include also just ensuring one's own safety, and they had these kind of awareness campaigns that are still ongoing, and I guess that comes to the conversation against of funding and ensuring that those organizations that play that part still get funded, even if it's not through the USAID, but from various other organizations and governments that are still available to fund.
But such initiatives will always be welcome. We have to fight this battle of HIV. Hasina, thank you very much for joining us this afternoon. That's SABC News reporter Hasina Gori, who's been following the Minister of Health today. They launched the new HIV treatment campaign.